So, hi ma'am, good day. My name is Eirene GAPATE from NR11 Group 2, and today I am going to demonstrate the procedures in assessing the head, neck, eyes, ears, nose, mouth, and throat. So, starting with the preparation, identify and assemble all the equipments to be used, because organizing and gathering all the equipments to be used prior to entering the patient's room saves a lot of time and reduce the chances of errors and distraction. Now, introduce self and verify the client's identity, because self-introduction is an effective communication skills that is essential to establish therapeutic nurse-patient relationship or rapport. While verifying the client's identity ensures that the right patient receives the needed assessment for specific treatment. So, hi sir. Good morning. Ako po si Eirene, first year nursing student from UDM. Ano pong pangalan niyo sir? Patingin po ng blue card.
James Leeward.
Anong pong apelido nyo?
Mainsoy.
Okay. Kailan po kayo pinanganak?
December 17, 1999.
Okay. So, ilang taon na po kayo ngayon?
21.
Okay, good. Now, explain to the patient the procedures to be done, why is it necessary, and how the patient can cooperate to facilitate patient's participation and cooperation with the procedure, and of course, reduce patient's anxiety. So, sir, ganito po ngayon, magko-conduct po ako ng assessment sa inyong ulo hanggang leeg, kabilang na dyan yung inyong mata, ilong, bibig at tenga, para po ma-distinguish natin kung meron kayong mga underlying conditions na kailangan ng agarang aksyon. So, later on, may mga itatanong din ako sa inyo about sa inyong past, present, and family history. Kabilang na rin doon yung sa inyong personal health. Okay lang po ba sa inyo?
Okay.
Okay, good. Next, perform hand hygiene and observe other infection control procedure to reduce the chances of transmitting pathogenic microorganisms and further protect the patient from contacting infections. So earlier, I have already washed my hands. So now, I will just be donning clean gloves. So next, provide privacy and comfort to the patient, because ensuring client's privacy can promote an effective communication between the nurse and the patient, which is essential for quality of care, enhance autonomy, and prevents economic harm, embarrassment, discrimination, and protects the patient's dignity. While such comfort reduces the negative impact of hospitalization and helps the patient to respond positively to the treatment. So earlier, I have already closed the door and the window openings to provide clients privacy. So sir, ngayon, kamusta po? Comfortable naman kayo?
Apo.
Okay, good. Then after that, position the patient accordingly to reduce patient discomfort, and of course, makes it easier for me to locate the specific body parts of the patient to be assessed. So as of now, the patient is already in a sitting position. Now, for the assessment procedure, conduct health history taking first to collect subjective data about the patient's present health, any past experiences, past medical history, family history, personal and psychosocial history, which all may affect the health condition of the patient's eyes, ears, nose, mouth, and throat, including his head. So, ngayon sir, may tatanong ako sa inyo tungkol lang sa history ng inyong health. Start muna tayo sa past, or sa present muna pala. Present history, ngayon, sa health nyo ngayon. Meron ba kayong napapansing ang pagbabago sa inyong ulo?
Wala.
Mata?
Wala.
Bibig?
Wala.
Ilong?
Wala.
Tenga?
Wala.
Sa inyong lieg?
Wala din.
Very good. Next, sir, meron ba kayong chronic conditions ngayon na nakaka-apekto sa health ng inyong mata, ilong, bibig, tenga, gaya
Wala.
ng katarata?
Wala.
Glaucoma?
Wala.
Headaches or migraines?
Wala.
Wala rin. Very good. Hearing loss?
Wala.
Very good. Oral cancer?
Wala rin.
Wala rin. Very good. Blindness?
Wala.
Very good. HIV?
Wala.
Diabetes? Very good. How about, sir, sa inyong medications? May iniinom ba kayo ngayon na medications? Very good. Sige, dako po tayo sa inyong past health history. Nagkaroon po ba kayo ng injury in the past sa inyong head,
Wala.
mata,
Wala.
tenga?
Wala.
Wala. Very good. Sa inyong bibig,
Wala.
leeg?
Wala.
Very good. Nagkaroon po ba kayo ng surgery sa inyong mata,
Wala.
ilong,
Wala din.
tenga,
Wala.
sa bibig?
Wala din.
Very good. Sa leeg?
Wala.
Very good. How about sa past nyo, sir, nagkaroon ba kayo ng chronic infections na maaring maka-apekto sa mga mata, sa inyong bibig, tenga, at sa iba pa? Gaya ng sipon, sir?
Wala.
Wala naman. Sa inyong childhood, hindi kayo nagkaroon ng kahit simpleng sipon?
Siyempre nagkaroon na.
Okay. Paano nyo yun, sir, tinitreat? Paano nyo ginagamot? May iniinom ba kayo na medicines?
Wala. Nababayaan ko lang.
Okay. How about sa adulthood nyo? Ganon din? Okay. Sa family nyo, sir, meron bang history ng cancer?
Wala.
Very good. Ng pagkabingi?
Wala.
Pagkabulag, panlalabo ng mata? Wala. Very good. Sa thyroid nyo, sir, yung halimbawa, goiter?
Wala.
Wala. Very good. Dako po tayo sa inyong personal and psychosocial health history. Kailan po ang last routine exam o kailan huling na check up ng doctor yung inyong bibig pati ipin?
2017.
Okay. Anong reason, sir?
Yung ano lang,
Na
pabunot lang.
nagpabunot ng ipin? Very good. Sa mata, sir, kailan huling na check ng doktor yung inyong mata?
Noong 2019.
Ano pong reason?
Yung malabo. Nagsuot ako ng salamin.
Panlalabo. So, nagsuot kayo ng salamin.
2 buwan.
2 months lang kayo, sir, nagsuot
Opo.
ng salamin? Bakit?
Kasi sumasakit ang ulo.
Okay. How about sa hearing nyo, sir? Kailan huling na-check ng doctor? O na-check na ba siya ng doctor?
Hindi.
Hindi pa? Ever since?
Hindi.
Okay. Gumagamit kayo, sir, ng denture or yung postizo?
Hindi.
Hindi. Contact lens?
Hindi.
Nakagamit na? Hindi. Yung eyeglass nyo, sir? Kailan yon?
2 months.
2 months lang kayong gumamit? Okay. Gumagamit po ba kayo ng hearing aids?
Hindi.
Hindi rin. Very good. Sir, anong ginagawa nyo, ang daily activities nyo para ma-maintain yung health ng inyong mata, ilong at bibig?
Nagsisipilyo ako. Tutulog ako ng sa oras para hindi sa mata. Hindi lumabo.
Sa tenga nyo, sir, anong ginagawa
Wala
nyo?
naman.
Okay.
Ayos naman.
Gaano kadalas po kayong maggamit ng cotton buds?
Araw-araw.
Every day?
Tapos maligo.
Nakakailang cotton buds po kayo, sir, sa isang araw?
Minsan 2 lang.
2. May mga alam po ba kayong activities na nakakasama sa inyong mata, tenga, bibig,
Wala.
sa bahay?
Wala.
Nagtatrabaho po ba kayo ulit?
Hindi.
Okay. Very good. So, I will now proceed to the assessment of the head and face. First, observe the skull and note for the size, shape, and contour to recognize any deformities and abnormalities that may indicate certain conditions. So, as per my observation, the skull of the patient is round or normocephalic. Prominences on his frontal area, occipital area, and the mastoid process behind his ears are also present with a symmetrical smooth contour. Next, I will inspect the scalp of the patient in several areas by separating his hair in various locations, and I will note the presence of lice, nits, and lesions. So, separating the hair makes it easier to assess any scalp abnormalities, and the lice, nits, lesions will be more visible. So, sir, inspect lang natin yung scalp nyo. Magduko po kayo ng bahagya. Ayan. Okay, thank you, sir. So, alright, the hair color of the patient is black with an occasional gray hair present. The hair is coarse in texture, I think due to being curly. And it is evenly distributed and it covers the whole scalp of the patient. Aside from that, the scalp of the patient is, I think, 1 to 2 shades lighter than his entire complexion, and it is moist or oily. It is free from lice, nits, dandruff, and lesions. Now, I will palpate the head of the patient by running the pads of my fingers over the entire surface of his skull, and I will inquire about tenderness upon doing so. This is to immediately recognize the exact spot of the tenderness or lesions if it is present. So, palpate natin yung yung head nyo. Sabihin nyo po sa akin kung may masakit dito. Sa lahat ng dadaanan ng aking kamay. Yan, may masakit po ba dyan?
Wala.
Dito?
Wala.
How about dito?
Wala rin.
Diyan? Dito?
Wala.
How about dito, sir?
Wala din.
Dito?
Wala.
Wala. Okay, very good. So, tenderness or masses is not noted or not observed upon palpation. Now, I will inspect the face of the patient and I will take note for the shape and symmetry because any facial asymmetry may indicate certain problems with one or more cranial nerves. So, inspect natin, sir, yung inyong mukha. Okay. So, the face shape of the patient is oval. The palpebral features of the patient is quite equal in sizes and the nasolabial folds are quite symmetric. There are no involuntary muscle movements and lesions observed. Aside from that, the skin is consistent with his overall complexion, but darkened, flat acne scars are present. Now, I will test the patient's trigeminal nerve or cranial nerve 5. I will ask the patient to close his eyes while I touch a cotton wisp and a sharp object on both sides of his forehead, cheeks, and jaw, which we call as the ophthalmic zone, the maxillary zone, and the mandibular zone. Oops. So, sir, pikit niyo yung mata nyo and then sabihin nyo sa akin, yes. Sabihin nyo yes if naramdaman nyo yung sensation or soft sensation, okay? Okay, close your eyes, sir. Say yes if you feel the soft sensation.
Yes. 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 Yes.
Okay?
Yes. Yes.
Okay. Okay. Ngayon naman, sir, say yes if you feel the sharp sensation.
Yes. 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 Yes.
Okay, very good. Now, I will ask the patient to determine and recognize the sharp and soft sensation as I alternately touches this on both sides of his forehead and cheeks and jaw. So ngayon, sir, sabihin nyo kung soft or matulis or sharp Kung ano yung naramdaman nyo, sabihin nyo. Okay? Okay, close your eyes, sir.
Tulis.
Okay.
Lambot.
Okay.
Tulis.
Okay.
Lambot.
Okay.
Lambot.
Okay.
Matulis.
Okay, very good. Now, I will test the patient's corneal reflex and I will touch this new cotton wisp on the corneas of his both eyes. Sige, sir. Touch lang natin ito ng bagya and dilat kayo. Okay. Okay, very good. Now, I will ask the patient to chew and clench his jaw to assess the muscles of mastication. Then, with that saying, I will palpate the temporal and the masseter muscle. So, sir, nguya kayo. Nguya kayo ng bahagya. Okay. Sige. Alright. Sige, sir. Ibuka po nyo yung bibig nyo and then i-resist nyo, sir. Okay, now I am going to palpate the patient's temporomandibular joint to check for any clicking sensation as the patient opens and closes his mouth. So, sir, buka nyo and isara nyo yung bibig nyo continuous. Sige, sara nyo, sir, continuous lang. Okay, and I feel none. Okay, sir, sige. So, the patient is able to feel and recognize a light or soft and sharp sensation. There is no decrease or unequal sensation. He elicits blink reflex during corneal reflex test. And the muscles of mastication or muscles for mastication feels firm bilaterally. Thus, the cranial nerve 5 is intact. Now, I will test the patient's facial nerve or cranial nerve 7. So, sir, tingin kayo dito. Close your eyes tightly. Yung madiin, sir. Madiin. Yan. Tapos, resist nyo, sir. May open ko siya. Resist nyo, sir. Okay. Okay. Sige, sir. Dilat na kayo ulit. Simangot nga kayo, sir. Kunot nyo yung noon nyo. Okay. Smile. Okay. Very good. So, the patient, puff your cheeks pala, sir. Puff your cheeks. Okay, resist nyo. Ipuputok ko. Okay, okay, very good. So, the patient did all that with an ease. So, the presence of muscle weakness or loss of movements or asymmetry of movements is not observed. Thus, cranial nerve 7 or the facial nerve is intact. So, I will now proceed to the assessment of the eyes. First, inspect the eyes, the eyebrows, and the eyelashes. And note for the color, shape, position, and symmetry. So, inspect lang natin ang inyong eyes. Close your eyes, sir. Open it. Okay. Ang eyebrows nyo. Tingin po ako ng inyong kilik nito. Okay. So, the eyebrows are present bilaterally. It moves equally and symmetrically. The eyelashes of the patient is evenly distributed and it is turned outward. Now, when it comes to the eyes itself, the eyeballs of the patient are aligned in their sockets. The eyes are in line with each other and there is no protrusion or sunken appearance. So, next, observe the symmetry of the lids and the palpebral fissures for the oculomotor or cranial nerve 3. So, itingin ako ng inyong pikit nga kayo, sir. Yung bahagya. Okay. Sige, sir, dilat na. So, the skin of the upper eyelids of the patient is intact with no redness, swelling, discharge, or lesions. It is symmetrical, and the upper lids covers a small portion of the iris, cornea, and the sclera when the eyes are open. Aside from that, there is no drooping of the upper eyelids, and it meets completely when the patient's eyes are closed. And of course, the palpebral fissures are again equal in sizes. Next, I will palpate the lacrimal glands and the nasolacrimal ducts to recognize blockage of nasolacrimal ducts, which often leads to an excessive tearing or regurgitation of fluids from nasolacrimal duct. Okay, sir. Inspect ko lang or ipapalpate natin yung... Okay. May masakit ba dyan, sir?
Wala.
Okay. May masakit dito.
Wala.
Dito. May masakit ba
Wala.
dyan? Dito. Meron?
Wala.
Okay, very good. So, there are no tenderness upon palpation. The glands are non-palpable, and there is no regurgitation of fluid from the nasolacrimal duct. Next, I will inspect the palpebral and bulbar conjunctiva. I would like to also demonstrate how to inspect the conjunctiva of the upper lids. Though this maneuver is not always a part of a normal examination, this is very useful if ever the patient or the client complains eye pain and is suspicious for foreign object. So, I will get a cotton swab, a new cotton swab that I will use later. So, sir, tingin sa taas. Tingin lang po sa taas. Sige, sir, tingin lang kayo sa taas. Okay. Ayos kayo ng upo, sir. Okay. Tingin po kayo sa baba. Sa baba. Okay. Saglit lang po, sir, ha? Okay. Okay, next, sir, sa susunod na mata. Tingin po kayo sa baba. Huwag po kayong pipikit. Okay. Okay, thank you. So, the eyeballs look moist and glossy. Numerous small blood vessels are present or shows through the transparent conjunctiva, which is normal. Now, when it comes to the color, the conjunctiva is clear and shows the normal pink color of the upper and lower lids and the white color of the sclera. There is no color change other than pink, and there is no lesion or discharge. I will now inspect the iris of the patient and I will take note for color, shape, and size. So, tignan natin ang inyong mata, sir. Okay. So, the iris of the patient is round and fairly flat with a consistent coloration. Now, I will assess the patient for visual acuity with the use of Snellen chart for the optic nerve or cranial nerve 2. So, sir, ngayon, meron tayong chart doon and I want you to read kung alin yung pinakamaliit na nababasa ninyo ng malinaw. Okay? Doon.
TOZ. Yun lang malinaw sa akin.
Okay.
TOZ.
TOZ.
LE.
Okay. So, the patient's vision is 20/70, which means that he needs 20 feet distance to read letters that can normally read with a normal vision 70 feet away. I will now perform a test for EOM or extraocular movements, which is the 6 cardinal gaze that corresponds to the cranial nerves 3, 4, and 6. So, sir, ito. Sundan nyo tong ballpen ko. Mata lang ang gagalaw habang nakasteady yung inyong ulo, okay? Okay. Okay, very good. So, parallel tracking of an object with his both eyes is strongly observed. The upper lids of the patient continues to overlap the superior part of the iris and even in a downward movement. Thus, there is no lid lag. Now, I will inspect the pupils for shape, size, and symmetry. So, tingnan natin ang inyong pupils. Tingin dito, sir. Okay. So, the pupil diameter of the patient appears to be 3 millimeters. It is round and is equal in size with his both eyes. So, now I will assess the patient's pupillary light reflex and the pupil's response for light and accommodation. I will also perform a test for convergence. So, sir, tingin kayo dito sa akin ng diretso. Dito, sa aking ilong. Yan lang ang titignan niyo, sir, ha? Okay. Okay, very good. Ngayon, sir, tingnan niyo to. Sa taas. Ha? Sundan nyo lang siya ng tingin. Okay. So, both of the patient's pupils constrict during pupillary light reflex, and it is direct and consensual. Now, during the test for accommodation, pupil constriction is again observed together with the convergence of the axis of his eyes. Now, I will perform the cover and uncover test to check the presence and the amount of ocular deviation, such as the trophia and phoria. So, ngayon, sir, tingin kayo dito. Dito kayo tumingin. Diyan. Tatakpan ko ito. Tignan nyo lang to. Okay. Ito. Okay. So, there are no movements occur, either covered or uncovered. Thus, the eyes of the patient is aligned. Next, use an ophthalmoscope to assess the optic nerve or cranial nerve 2 as it produces an upright image of approximately 15 times magnification, which allows the nurse to look at the back of the eyes and look at the health of the retina and the optic nerve. Now, for the assessment of the ears, first inspect the auricles of the ears for parallelism, size, position, appearance, and skin color. So, sir, inspect lang natin yung inyong tenga. Okay, namanan nyo ba yan, sir, sa parents nyo?
Father side.
Okay. So, the ears of the patient have an equal size bilaterally with no swelling or thickening. Then, the ears of the patient appears to be a little bit larger than usual due to familial trait, thus there is no clinical significance. Now, the skin color of the patient is consistent with his facial skin color, and the skin is quite intact with no lesions or lumps. Aside from that, the top pinna of the patient's eyes is aligned directly on the outer canthus of the patient's eyes. Now, palpate the auricles and the mustard process for firmness and tenderness. So, sir, ano natin yung tingnan nyo. sakit dito?
Wala.
Dito?
Wala.
How about dito?
Wala.
Dito?
Wala.
Dito?
Wala.
Dito?
Hindi.
Sure? Masakit
Hindi.
kapag ginaganon?
Hindi.
Dito sa kabila. Okay. So, upon palpation, the upper part of the patient's ear feels firm and flexible, and the earlobes are soft. So, any movements of the ears does not produce any pain, and palpation of the mastoid process does not produce pain as well. Now, inspect the auditory mucus or the ear canal for the color, presence of cerumen, discharges, or foreign bodies or objects. But since I don't have an otoscope, I will just use my pen light to lighten the ear canal. So, tignan na natin yung tenga nyo. Sa kabila. Yan po. Okay. So, there is no swelling, redness, or any foreign objects, but some light brown and dry cerumen is present. Now, perform an otoscopic examination of the tympanic membrane to immediately assess any abnormalities within that area. Now, I will assess the patient for hearing acuity, which tests the cranial nerve age. So, let's begin the test for the whisper test or voice test to assess high-frequency hearing. So, sir, i-occlude natin yung isang tenga nyo. Then, bubulong ako dito sa hindi naka-occlude na tenga. Tapos, gusto ko ulitin nyo yung ibubulong ko if narinig nyo, okay? Okay. 1V2.
1V2.
Okay, next. 6L5.
6L5.
Okay, very good. So the patient is able to hear and repeat the random numbers and letters I say correctly. Now, I will perform or conduct a Eirene test to evaluate hearing loss by comparing the air conduction to bone conduction. So the patient is expected to hear a long-lasting sound through air conduction as it is a route through the ear canal which is more sensitive. So, ayun sir, tawag dito is tuning fork. Patutunugin ko to. Then, kapag napatunog ko to, ilalagay ko dito sa part ito, dito sa likod, yung tenga nyo, sa buto. Tapos, if nag-stop na yung sound, pakitaas yung hintuturo, okay? Pagtapos nun, ito naman, itatapat ko sa tapat ng tenga nyo. Ganun din. Taas nyo rin yung hintuturo nyo. Okay. So, as expected, the patient heard the tone twice longer when the tuning fork is placed in front of his ears, which correspond to the air conduction, than the heard tone when the tuning fork is placed on his mastoid process, which correspond to the bone conduction. Now, I will conduct a Weber's test for the last ear test. And sir, gagamitin ulit natin to, tapos tutunugin ko ulit siya. Then, ilalagay ko naman to ngayon dito sa inyong noo. Then, sabihin nyo sa akin kung saan nyo narinig yung sound. It's either sa kanan, sa kaliwa, or pantay lang. Though, mahina lang naman maririnig nyo, pero maririnig nyo pa rin, okay?
Parehas.
Na? Okay. So, the patient is able to hear the sound equally on his both ears. Now, I will proceed to the assessment of the nose and sinuses. First, I will inspect the external structures of his nose. For placement and symmetry, I will also check for nasal flaring and discharge. So, sir, tingnan lang natin yung nose ninyo. So, the skin surrounding the nose of the patient is quite smooth and intact. Then, this So, the skin surrounding the nose of the patient is quite intact with the color or skin color matching the rest of his face. It is symmetric and it is in the midline. Nasal flaring or rather nasal flaring and discharge is not observed. Now, I will check the patency of both nares by occluding one nares at a time. So, sir, occlude natin yung isang butas ng ilong nyo, tapos gusto ko mag-inhale, exhale kayo ng malalim, okay? Bila. Okay, good. So, the patient is able to sniff with each or both of his nose, and it is noiseless and with an ease. Now, upon palpation, the nose have no tenderness. Now, I will test the patient's sense of smell or the cranial nerve 1. So, sir, close nyo yung eyes nyo. Wait lang. Tapos, occlude ko yung isang butas ng ilong nyo. Then, sabihin nyo sa akin kung ano yung naamoy nyo. Okay? Sige, sir. Ano?
Deodorant.
Okay, sige. Sa kabila naman po.
Deodorant.
Okay, very good. So, the patient is able to recognize and identify the smell I gave to him, which is a deodorant. Thus, cranial nerve 1 is intact. Now, I will inspect the internal nares for the position of his septum and nasal mucosa. But again, since I don't have an otoscope and nasal speculum, I will just elevate the tip of his nose using the tip of my finger. Then, I will use my pen light to lighten the internal nares. Okay. So, the nasal septum is quite intact and it lays in the midline. There is a sufficient room for nasal passages and the nasal mucosa appears to be pink and moist. Now, I will inspect and palpate the external nares of the patient for bone displacement, tenderness, and masses. So, sir, may sakit ba dito?
Wala.
Dito?
Wala.
Dito?
Wala.
Diyan?
Wala. Wala.
Okay, good. So, upon palpation, there is no tenderness, bone displacement, pain, or masses noted. Now, I will palpate and percuss the paranasal sinuses of the patient, which is the frontal and the maxillary sinuses, to note or recognize any abnormalities that may indicate acute or chronic conditions such as sinusitis or allergy. So, sabihin niyo, sir, kung merong masakit.
Wala.
Dito.
Wala. Wala. Wala din.
Diyan.
Wala. Wala. Wala.
Pe-percuss natin, sir, ha. Sabihin niyo kung may masakit ulit.
Wala.
Diyan.
Wala.
Okay.
Wala din.
Dito.
Wala din. Wala.
How about dito?
Wala.
Yan.
Wala din. Wala na.
Okay. So, upon palpation, there is no pain or tenderness, and the sinuses gives me a tympanic sound during percussion. Now, I will transilluminate the patient's sinuses using my pen light. So, ipikit kayo, sir. Tignan lang natin yung inyong. Okay. Okay, sir. Tignan natin yung sa inyong hard palate. Apa, sir. Okay. So, a dim red glow is transmitted on the eyebrows of the patient and below the hard palate of the patient, which indicates or means that the paranasal sinuses is free of congestion and secretions. Now, for the assessment of the mouth, first I will inspect and palpate the lips of the patient. So, sir, inspect natin lips, no? Ano natin sa kabila? Sa kabila. Okay. So, upon inspection, the lip color of the patient is pink and it is symmetric both vertically and laterally. They are smooth and moist and a slight vertical linear markings is present. Aside from that, presence of a distinct borderline between the lips and the facial skin color is also observed. Now, I will inspect the teeth of the patient. So, tignan natin ang teeth ninyo. Sige. Oops. Sige May isa kayong walang ipin, sir, ha? Okay. So, upon inspection, the teeth of the patient is a little bit yellowish in color, and the patient has two missing teeth, both on his upper and lower teeth. Now, aside from that, the upper back of the patient's teeth lays directly on the lower back teeth. And the teeth are evenly spaced and it is firmly anchored. Now, I will inspect and palpate the buccal mucosa, the gums, and the tongue. So, sir, titignan lang natin yung loob ng bibig niyo, sir, ha? Okay, sir? Sige, mamaya. Tignan muna natin itong dito sa likod. Taas. Sige, sir, Tungo kayo ng bahagya, sir. Yan. Okay, sir. Yan. Wait lang po, Sige, dito sa kabila. Sige, tignan natin yung dila niyo, sir. Labas niyo ng bahagya. Okay. Touch nyo nga po yung alang-alang nyo. Okay. Sige, sir. Tignan po natin, sir, yung inyong dila. Sige, sir, labas nyo. At ano natin. Okay. Ngayon, sir, ipapalpit ko lang yung dito sa baba, ha? Okay lang? May masakit ba dyan, sir? Okay, wala. Sure? Okay, good. Palitan lang natin yung gloves, sir, ha? So, the color of the patient's buccal mucosa is pink with slight vascularity. It is smooth and a transverse occlusion line adjacent to where the teeth meet is also observed. There is no nodules or lesions present in that area. Now, the gingiva around the base of the patient's teeth is pink and moist in appearance with a clearly defined margin at each tooth. Now, when it comes to the tongue color is pink but a thin white coating is present. So, the dorsal surface of the patient's tongue is roughened by a papillae, which is normal, while the ventral surface of the patient's tongue is smooth and shows some veins. So, saliva is present, but patches, lesions, ulceration, nodules is not present in that area. So, in addition, I have also inspected the entire U-shape below the patient's tongue and behind the teeth, because oral malignancies are most likely to develop here, and the patient don't have any ulceration, patches, lesions, or nodules in that area. Now, I will test the patient's tongue strength or the cranial nerve 2. So, sir, can you move your tongue up and down? Up and down. Side to side. Okay, good. So, the patient is able to move his tongue in any direction with an ease and without any tremor. It is protruding in the midline. Thus, cranial nerve 12 is intact. Now, I will test the patient's taste sensation, which corresponds to the cranial nerve 7 or cranial nerve 9. So, ngayon, sir, meron akong ipapatikim sa inyo, and paki-identify sa akin kung ano yung lasa niya. Para sa inyo, ha? Okay. Pakilabas ng dila niyo, sir. Sige. Tungo kayo ng bagay.
Tamis.
Okay. Next. Sige, sir. Next.
Maalat.
Okay, good. Ngayon, sir, very slight lang ibibigay ko sa inyo. Dikit na lang natin.
Asin.
Okay, very good. So, the patient is able to differentiate and identify the taste I gave to him, which is the sweet, sour, and salty. Thus, the cranial nerve 7 and cranial nerve 9 is intact. Now, I will proceed and I will inspect the throat of the patient. So, sir, inspect natin yung lalamunan nyo, okay? Let's see. Up kayo. Okay, sir. Ganyan. Yan, sige. Ana malaki. So, the tonsils of the patient is color pink, just the same with the color of the oral mucosa. It is 1+, and their surfaces are peppered with indentations or crypts. Now, I will observe the symmetrical rise of the soft palate while the patient says and he swallows. So, this test the cranial nerve 9 and 10. So, sir, say sir. Mahaba? Okay. Tingnan natin. Okay. Very good. So,
Very
the
good.
patient elicits gag reflex and the uvula and the soft palate raise in the midline. Then, the tonsillar pillars move medially and the voice sounds of the patient is quite smooth and not strained. Thus, cranial nerve 9 and 10 is intact. Alright, so I will now proceed to the assessment of the neck and I will first inspect for position, symmetry, and presence of any lumps. Okay, sir. Pwede mo bang i-tilt yung head nyo backwards? Okay, titignan ko lang. Sige, sir. Yuko nga kayo, sir. Okay. Sige, sir. Okay na? Tingin nga po kayo sa kabila. How about dito? Okay. Tilt nyo, sir, yung ulo nyo, side to side. Okay. So, the head and neck position are centered in the midline and the accessory neck muscles are quite symmetric and the head is held erect and still. Aside from that, all the movements that I have instructed the patient to do were all performed with an ease. It is all controlled and it is smooth and is painless. Now, I will palpate the thyroid of the patient using the anterior and posterior approach. So, sir, wala lang kayo sa konti. And then, pag sinabi ko pong lumunok kayo, lunok po kayo, okay? Wait lang ha. Okay, lunok kayo, sir. Sige pa. Okay. Next. Wait lang po. Sige, sir, lunok. Sige pa po. Okay. Let's try and posterior. Sige, sir, lunok. Okay. Sige, sir, lunok. Okay. So, upon palpation, the thyroid of the patient is non-tender. It is soft and small both in the left and right lobe. Aside from that, the thyroid tissue moves freely during swallowing, meaning say it moves up during a swallow and then falls back again into its resting position. Now, auscultate the thyroid if enlargement is noted, but I did not notice any enlargement. Thus, I will not auscultate the thyroid of the patient. Next, I will palpate the lymph nodes of the patient using the palmar tips of my fingers and via systemic circular movements. So, sir, tell me kung may masakit, okay? May masakit po dito.
Wala.
Okay. Dito.
Wala.
Wala.
Wala
Sure.
din. Wala.
How about dito?
Wala.
Okay. Okay, dito, sir, may masakit dito.
Wala.
Dito.
Wala din.
Wala.
Wala din.
Dito.
Wala.
Okay. How about dito, sir? Masakit yan.
Wala.
Dito.
Wala din. Wala din.
Yan.
Wala.
Okay, good. How about dito, sir?
Wala din.
Okay, dito.
Wala.
Okay. So, upon palpation, the nodes are soft. It is non-tender. There is no swelling, enlargement, or hardness present. Now, inform the client if the procedure is done to prevent misunderstanding, which often leads the patient from waiting too long. So, sir, okay na po yung assessment natin. Tapos na and pa-wait na lang si Doc, okay?
Okay.
Then, perform aftercare procedure to help the patient get back his confidence. Then, after that, document all the assessment findings in an appropriate forms. So that is all for the assessment of the head, neck, eyes, ears, nose, mouth, and throat. Thank you.